The Connecticut and Rhode Island region of the American Red Cross would like to welcome you to this presentation of Coping and Self-Care During Stressful Times. Your presenters today are Wayne Dailey and David Denino, Disaster Mental Health Regional Program Co-Leads for Disaster Cycle Services in the Connecticut and Rhode Island region. Wayne is a clinical psychologist with over 40 years experience and has been a volunteer with Red Cross since 2002. During this time, Wayne has supported those affected by disasters large and small, including some mass casualty events across the United States. Wayne has done extensive research and has been published in scholarly journals. Dave, like Wayne, brings over 40 years as a licensed professional counselor and nationally certified counselor. Dave serves as Director Emeritus of Counseling Services and Adjunct Professor of Clinical Mental Health at Southern Connecticut State University. Dave has been with Red Cross Disaster Mental Health since 9/11 and has supported multiple major disasters and mass casualty responses across the United States. Wayne and Dave, take it away.
Well, first, thank you, Jamie, for a very kind introduction. And it's great to be with my buddy Dave here and with all of you. And we're glad that you were able to log on to this video presentation. We hope that this will provide you with some useful information as we all deal with this very stressful time that we're going through with the pandemic. And this really is a unique, stressful time. Many of us are in self-quarantine right now. Others are in isolation, and some others yet are in the hospital, and some have died tragically. And we dread the thought that there may be more of that ahead. Now, pandemic is a different kind of disaster. It's really quite unique. It's not like the hurricane and the tornado where, the event goes by in a matter of either minutes or hours, or within a few days it's come and gone. Pandemic doesn't seem to have a sort of an easy to define beginning point, nor does it have an easy to define or identify endpoint. And then when you think it's gone, it can come back again. So that's all very unsettling. And then you can't see it, you can't smell it, you can't taste it. And most unsettling, I think, for me is that you can get it from people who appear to be healthy, or from a loved one or a friend. So, it's invisible in a hurricane. When it's time to get inside, it's easy to see, except if you happen to be a weather reporter, and then you're standing out in the surf. But this is very unsettling. It's difficult to deal with, and we have to follow public health instructions to the T. Let's go on to the Dave. Before I go talk about objectives here, Dave, is there anything you'd like to add there?
Just a welcome to everyone, and I'll echo what Wayne said. Thanks for taking a look at this for the next several minutes, and we hope that the next 30 minutes can be very informative and helpful to you all. And I think Wayne framed everything beautifully. This has no beginning and maybe no end for the foreseeable future as we deal with it. And as Wayne put it to me one time before, it doesn't have bookends like other things that we've experienced in life. So with that, you can move along to some of the objectives.
Okay, let's see now. So our objectives are to review the signs of stress that we observe in a pandemic, and to discuss the importance of self-care and steps that you can take to promote self-care during a pandemic, and also to provide clarity with regarding when you should seek help from a mental health professional or some other intervention for someone that is struggling with the effects of pandemic. Okay, Dave, anything on that one before we?
No, that's pretty much it. It's about how you take care of yourself, how you identify those things and take care of yourself. So we can start in on the stress part of it, which is, I think, is the one of the pillars of why we're talking with you today.
So So when stress is extreme or prolonged, people can get stress reactions. And we know that these include agitation, helplessness, self-neglect, personality change, and withdrawal. These are among the kinds of things that we observe. I'll just mention a few of them, like in personality change. You might have someone who is usually quite affable and friendly and easy to get along with, who suddenly becomes very grouchy, very difficult to deal with, oppositional, that kind of thing. Mm-hmm. Or in the case of someone who withdraws in a pandemic, it could be like being in a quarantine inside of a quarantine. That's the way I would describe it, is that not only are they sequestered in quarantine, but they're also not talking with friends and family members. They won't take phone calls. They're not returning text messages and emails. So they're kind of like really pulling away, and that's quite concerning. So we know when this kind of stuff happens that we have to pay attention to it, because we know that if it's left unchecked and not dealt with, that it can cause lasting psychological harm. It can actually lead to various forms of mental illness, such as post-traumatic stress disorder, anxiety disorders, and major depression. So we've really got to take steps to guard against that and to protect ourselves and our loved ones from those kinds of impacts. David?
Yeah, I mean, it's watching out for it in all of us, the people around us and ourselves. And, it really is up for everybody now. Yeah, on a scale of 1 to 10, everybody's experiencing some kind of stress that's a little more difficult to deal with than you do in your average, living without being in the middle of a pandemic. So as Wayne said, when stress goes up and it becomes prolonged, it can become very risky for people. And I think he identified in what he had to talk about was about those things that come together in your daily living that we all deal with, and how our behavior might be affected for better or for worse, kinds of body or physical symptoms we get, maybe our emotional well-being in terms of lashing out or becoming more withdrawn, and sometimes our thinking skills, just cognitively, what do we do day to day to solve our problems? Maybe that becomes diminished with the stress that what the pandemic has given us, which is, for some of us, lack of employment. They lost their jobs or they're furloughed. Relationship issues, coming together as a family, living under one roof for a long time. So I think you got it. We know what stress is in our lives. We know how to deal with it day to day. This is kind of outside of the box situation for a lot of us. So I think we could move on to kind of get a little more about that discussion, maybe with the next slide, Wayne.
Okay, Jamie, can you take? Okay, here we are. We're going to talk about calling stress 101. So what is stress? What's normal? What's not really normal? And what we've done here is we've broken stress down into 3 categories. We're calling it positive stress, tolerable stress, and toxic stress. Now, let me explain. How could stress ever be positive? Well, actually, stress has been part of human existence since the time that men first, covered themselves with the skins of saber-toothed tigers. It's been with us for a long, long time. But that positive stress is of temporary duration, and it's not too intense. And it causes us to take action. And that action that we take is designed to make the situation better. So we create things, we build things, and by doing that, we reduce our stress. So that's why we call it positive stress. Tolerable stress is when we have a pretty intense level of stress, but the duration is not prolonged, or maybe it cycles in short bursts through this serious stress. And what we do is we use that kind of stress can be buffered by relationships with friends, with family, and through other resources that Dave is going to talk about a little later in this presentation. Toxic stress is really a different kind of thing altogether. toxic stress is bad. It's extreme and it's prolonged. And because it's so extreme and because it won't go away, it can cause damage to the body. And basically what we look at is this. When we're under stress for a long, long time, it releases a hormone in the blood called cortisol. And cortisol is a inflammatory hormone. And it causes inflammation in the cardiovascular system that can lead to heart disease, stroke, heart attack, or even death. So this is something that we really need to prevent from happening in our lives, obviously. And when we're in a pandemic, we're in a high stress, long event situation. So it's pretty toxic right now. We have to be very, very careful about that to dampen that toxicity and to provide the kinds of insulation that we need to protect us from the bad term effects of long-term stress. Anything, Dave, you want to add?
Yeah, I think, yeah, Wayne, I'd like to add, and those are great examples from positive to toxic, and we're borderline from tolerable to toxic now. Toxic now with everything that's going on, and what your job is in your individual life, and what people help out with, what mental health workers deal with is to bring the temperature down so it doesn't hit a 10, or if it hits a 10, to bring it down to a 9 or an 8 when it's affecting your life, or to prevent it from going up to a 10, which are some of the things we'll cover a little bit later on in self-care and seeking help. I think we start with the assumption that everybody's stressed right now. I said that before. On a scale of 1 to 10, you have some kind of stress, up to those folks, and maybe this is you as you're listening to this, who are extremely anxious about lots of things. You can normalize that based on the conditions that we're in, but we have to deal with it, and that's what we hope to kind of impart today in a little while, is to give you some skill sets where you can bring that temperature down. We're in a position where we have to take control of what we can, change what we can. And I think a key thing for us, for people, is to live well inside of this environment, is to accept what you can't change. And there's so much going on, in the government and the state government, local governments. We don't have a lot of control over that, but we do have control over our home and the people around us. So we want to, in the next couple of minutes, talk to you about how you could do that. And one important feature that Wayne and I talk a lot about is not judging yourself or judging others. It's not a time to become critical and really dig down and say, well, I don't believe that, I can't do that, you're wrong, I'm right. Really, you have to be more myopic and take a look at what you can and can't do. So staying away from that toxic part of stress is really important. And we certainly don't want to see it become a chronic thing. I think Wayne started out in the first or second slide talking about long-term issues that can be imparted into your life, that you no longer have those good, or at least very decent, coping skills. So that's what we're trying to help you out with, and we'll see, as we go to the next slide, which we'll pop along to, and we'll start to talk about, I think, a little bit of psychological resilience. And you can see there's a description there for you, that it's the ability to bounce back during hazardous crisis or dangerous situations. We're in the middle of one of those things now. So how do we bounce back, and what does that mean to bounce back? I think all of us have certainly a level of resiliency. I think you have to ask yourself some questions sometimes about how resilient were you in the past when other types of traumas or very serious conditions entered into your life. Those kinds of things can be, loss of a relationship. It could be loss of a job. It could be loss in terms of death, someone that died. And how did you come back from those types of things? What did you utilize to get through those difficult times. And that's not dissimilar to what we have to do now in terms of our psychological resilience. Again, everybody has some resiliency. The good thing is that resilience can be learned by, instruction in coping mechanisms, I think, and coping strategies, which we'll cover in a little bit, and certainly a lot about self-care. What does this do for us? It really helps us to adapt to life. It helps us make changes in life. I think you can ask yourself the question and think back just for a minute when really something rocked you on your back on your heels for a moment. How did you recover from that? How did you get through that? And some of the things we'll talk about in how you engage other people or other things to do better and to get back into that normal rhythm of life, if you will. Our problem, as Wayne said earlier, this is a prolonged event. This isn't like start today, finish tomorrow, clean up, and then we move on and pick up the pieces. This is weeks and this is months. So it really has to be very structured as far as how you manage your psychological resilience. So the questions asked on the slide are really, what does it mean to you? How do you build it? How do you like it? How does it work? And most importantly, I think, what happens when it stops working and you're not doing well? And I think we'll get into some of those. Wayne and I'll talk in the next couple of slides about coping strategies and the answer to stress and self-care. I think that the last comment I'll make here on this slide, and then I'll ask Wayne to chip in if he has anything to add to it, is how are you able to measure it? How do you measure what your psychological resilience is in a good day versus a bad day? And we'll talk about some of those in the coping mechanisms. Anything to add as a last kind of comment or word here, Wayne?
Well, no, I just want to echo something you said, David, in that a good part of psychological resilience can be learned. And so for those on the call or for those watching this video, please keep that in mind. And if you're not feeling the resilience right now, there are strategies out there to help you learn it. That's it.
Good, thank you. So in talking a little bit about the coping strategies that I brought up earlier, you can see a couple of things on the slide here that, stress management's in the middle of lots of things that are surrounded by that little happy face in the middle there, things that we might take advantage of to make us feel better. And then on the left side, it has things like maybe, being with your pets, perhaps shopping for some, but shopping online now instead of out in the store, exercise, meditation. So the question is, just think about, what have you utilized in the past that has worked for you? What did you do? What were the strategies that you came up with to help you? And this really, you see very positive images of coping strategies up here. And those good coping strategies are things like staying healthy, exercise, maybe enjoying nature. We can still go out for walks with social distancing. Laughing is one of the things that's contained inside of there. And it's okay to use humor even in the most drastic periods of time, because it does lighten the load a little bit for all of us, I think. So these kinds of strategies, good versus bad, and there's a lot of good things up on the slide. Now, conversely, we want to talk, and I'm going to get back to some of the good things in a moment, but I want to spend a moment on sometimes when we start to cope and we're not doing it so well and we're using negative kind of influences to guide our daily living. And those kinds of things that leak into stress and fear can be substance abuse issues with drugs or alcohol, overusing drugs and alcohol for sure, maybe getting a lot more testy about your daily relationships, that maybe your voice is raised a little more, maybe you yell a little more, you tell people to get out of your way a little bit more than you ordinarily would, or you do it at times when it's not the time it should be done. So those are a couple of examples of things that we want to stay away from by hopefully using more positive influencers if we can. And those kinds of good things, what is that around? So if you do exercise, are you continuing it? I can tell you, and most of you probably listening to this see more people out now because we're all home, but you see more people on the street taking walks with their families. So do that, or walk alone. Alone time is okay, perfectly fine to kind of like re-energize and kind of get your psychological well-being on par or back to par again. Um, Part of that comes with structuring your day, coping strategies. Our normal a day when we got up, had a cup of coffee, went to work, we got to work, we had a break, we went to lunch. All of our schedules are really out of sorts now. So I think it's important that you take a look at structuring your day. And at least picking one thing that you would like to get done that day that maybe is not work oriented, because we all have our jobs to hopefully those of us that are still employed, or even if you're job searching, what is the one thing you could do that day for yourself that's going to make it more positive? And I'll just give you one example. My wife and I are both in the health related fields. We never made menus in our lives. We day to day we would cook and eat. We make menus every Sunday night now since this thing has started to look at the forecast of what the week is, and it makes us feel better. One, because it makes us feel better. Two, because we have limited access to food at times, and we have to structure that a little bit differently. Also, inside of your daily living is I mentioned it before. It's about giving yourself time alone for your self-care. It doesn't mean that you have to crawl into the back room of your house and turn all the lights out and have it dark, but you have to give yourself some space because there's a lot of pressures that come in from a lot of people, maybe from your job, from society, from media influence, and we have to take a break from that occasionally and take some time to kind of be well. So you see a bunch of things up on the screen. What's worked for you in the past? Try to re-engage with that and maybe try some new things. And I'll let Wayne add a couple of points at this time.
I'll say very quickly one thing about coping, and that is all positive coping occurs in the here and now. We can't go back to fix things that have occurred in the past.
Right.
Don't even bother with that.
Yeah. So now and future. Beautiful.
Plan little things that you can do in the next few minutes or the next couple of hours to make things a little bit better rather than a little worse. That's what our focus needs to be on. Thank you, Dave.
And then, Wayne, that's perfect because our next slide really starts to talk about the answer to stress is self-care, which I kind of reiterated a lot of times here. And if you could read these as they go around the circle, and no one item is more important than another. It's what's important to you on a given day and how many of them are important and how many you can balance. The middle of this says you can't pour from an empty cup. So if your battery goes down, if your tank gets empty, you're not going to be able to take care of yourself. And the work Wayne and I have done over the years, particularly with the Red Cross, is about getting people to fill that cup back up, if you will. So part of this might help you do that. And as you go around the wheel, and there's no particular order, again, one's not more important than the other, but what are the physical things you can do to stay well in terms of self-care? That might be exercising, combined with the psychological part about is the inner thoughts that you have and maybe some of the wellness things or the mindfulness things that you could do to concentrate on how can my day go well, and pick that one thing each day that you can do. There's the emotional well-being. How do you do with that? What does that mean? Are you less or more tolerant in your relationships now? Certainly one that's on here, and it might not be for everybody, but what is your spiritual well-being? If you do have a higher being, what is your belief system like? Does it help you? Do you start to wane in terms of how you participate in your spiritual self-care because you might feel abandoned by your higher being? Why is this all happening? We have to tune into that and again, take a look at it. So whether you believe or you don't believe, it's about how do I take care of my inner self spiritually as well as physically and psychologically. I think the last two we have on here, which I find to be really important at this juncture, is our relationships and our workplace professional well-being. Certainly, for our relationships, We want to be mindful of those. I think people are on edge a lot more. So sometimes you got to count to 5 a lot quicker than you can count to 10, just to say, let this go. I'm not going to debate a political issue or a response issue based on my community, state, or government. I'm going to walk away from it and see how I can control what's local to me. And that affects your relationships clearly. Your workplace professional relationship, I guarantee you that probably has changed in a million ways. So how has it impacted you? How do you adjust your workplace without being with the people you worked with every day? Maybe for some of you that's a great thing, not to be in the office. For some of you it's not such a great thing, that you like that social connection. And I think we're social beings. We do like to do those types of things. So in terms of those physical, psychological, emotional, spiritual mechanisms that you can use, what can you use in terms of all of these things when you become upset? And we can talk a little bit, and I'll ask Wayne to kind of fill in a little bit here, but who can you call on to talk to? Is there somebody that you can talk to? Is it a friend? Is it a relative? Is it a workmate? If there's no one at all, we'll give you some resources at the end where you can find somebody to talk to about the issues that are happening in your life. What can you avoid day to day to make these things better in your life? And we've done a couple of these things for fellow Red Crossers as you're watching this, and we talk about people report back their music becomes more important, their outdoor activities, gardening, for example, becomes more important, connecting with friends they haven't connected with in a long time, exercising, getting to exercise because they haven't had a regime of doing that. So these are the kinds of things that I think you could surround yourself with. Would you like to add 1 or 2 points to that, Wayne?
Well, no, I think that is really very
Okay.
good. I think you've covered a lot there, and I thank you.
Great. All right. So then, I think the part we'll move on to is the next slide, and I'll let Wayne carry this a little bit, because when to seek help and how to seek help, particularly if you don't have avenues. But if you want to pick up on that, Wayne, go ahead.
So when should we seek help? Okay. Well, there's a couple of different decision points here. First of all, if someone is a danger to themselves or to others, and that danger and risk seems imminent, and they have a plan and a means to carry it out, and they're saying, I'm going to do this, then that's a very dangerous situation, and the thing to do is call 911. That's basically it. And they'll take the person to a place where they can be in a stable location, and then they can be properly evaluated and treated. And the next sort of priority is people who are making vague threats about hurting themselves. Say, I don't want to be in this world anymore. This life isn't for me. They're talking about going away, kind of thing, vaguely. If they don't have a direct plan and a direct means of carrying out their threat, then mental health can intervene and help to get them into a different course of action. Also, people that are experiencing confusion, or they disoriented, or they're experiencing severe emotional disturbance, or they're unable to care for themselves. Those are the kinds of people that we can assist with. Now, the third priority is for those that have intense reactions, such as uncontrolled crying or shaking, or someone who's actually feeling nauseous is related to their stress. Or if someone from a family member or a friend of the individual says, hey, can you go over and talk to Sally or Jack, because Sally needs someone to talk to right now. Those are times that mental health will get involved. Now, we also, in making a decision about getting mental health involved, we also look at what we call significant risk factors. So if if a family member has been hospitalized or has died because of COVID, or the individual has witnessed a death, and right now there are a lot of healthcare professionals who are witnessing death. Now, they do that on a pretty regular basis anyway, But in this environment, the number and the frequency of those deaths that they're witnessing is really putting a big strain on them. So that's somebody else who might need some assistance. Or if the individual is feeling helpless, hopeless, or very despairing, that's another indication that mental health services are needed. We also look at resilience and coping abilities, okay? So resilience can either be resilience is a positive connotation, but sometimes your resilience bank account might be overdrawn. For example, you may not have friends or family that you can count on for support, or you may have lost your job, or your business is about to fail, or you haven't received that money that was supposed to come in and your mortgage is overdue. So for those kinds of situations, that may be another indication if a person's resilience is sort of played out, that they may need mental health supports. The other thing that we look at is coping skills. Now, some people have very positive coping abilities. Their attitude is good. They're optimistic. They're, happy, or as happy as you can get under the circumstances. That's a very positive trait. Other people are negative. And if the person is negative, where they're neglecting what's going on with their health or their life or the kids, that's bad. Or if they're doing other negative coping behaviors like drinking too much, drunk driving, yelling at the kids, or neglecting the kids, or neglecting elders living in the household, or fighting with other family members or friends or the neighbors. Those are very concerning things, and those are times when we want to get mental health involved. Dave, anything you'd like to add?
I think you got it pretty well there, Wayne. And we're going to move on to the next slide. But these are uncharted waters, as that slide says. And the slide also says it's okay to ask for help. And the next slide will tell us how to seek help. And we'll take another minute just to kind of wrap up here with all of you. But how to seek help? Certainly talking to significant others in your life, family, coworkers, friends. They might be able to help you through things, but if you need more information and you need to talk to someone, and of course, certainly we're always worried about the suicidality of people when they become very desperate. So the Suicide Prevention Lifeline is up on your screen, but it provides not only that, but they actually are set up to talk to people about how they're coping with this pandemic. There's a disaster distress helpline, and then there's the National Alliance on Mental Illness. They all have COVID-19 pages, so you can get more of the information we talked about today based on just going to these websites or call these numbers. Our final thought slide, which is next, and then we'll do some concluding remarks here. Taking care of yourself is one of the most selfless things you can do in a time of a pandemic, and that's what we hope you can take away from what we've done with you today. That you start to take charge of what you're doing, that you break it down into the manageable chunks, if you will, and you can get through each day and each week and maybe each month. And remember to change what you can and what you can't. And limit your exposure to lots of information that it can become overwhelming. The slide says it's all about me, and me, and then it really is about us because we have to help each other through this. I thank you for kind of listening in today, and I'll let Wayne make some final remarks at this point.
I'm just going to say this quickly, Dave. They tell you when you get in an airplane that if the oxygen mask comes down, you need to put it on yourself before you put it on someone else, before you assist someone else. And that's true of preparedness, how we prepare ourselves to deal with pandemic. So being a little selfish can be a kind of a selfless thing right now. You got to strengthen your own portfolio before you can go out there and help other people. David, thank you so much for being my buddy through all of this.
All right. Thank you, Wayne. Thanks, everybody.
We would like to thank you for joining us for this presentation of Coping and Self-Care During Stressful Times offered by the American Red Cross. You can learn more about the American Red Cross and how we work in your community by visiting redcross.org.